Are you frustrated with constant blood sugar spikes, despite sticking to your diet and medications? What if the real reason your insulin resistance isn't improving and your HbA1c remains dangerously high is because you're missing just 3 essential vitamins? These are not just ordinary supplements. They are powerful tools that help manage fasting blood sugar, protect your nerves, heart, kidneys, and blood vessels, and even reduce post-meal glucose spikes by up to 20%. Ignoring them could silently worsen the complications diabetes brings every day. Let us begin with the first nutrient, one that could be the missing link in your diabetes management. Pyridoxal 5-phosphate, the active form of vitamin B6. Vitamin B6, especially in its active form, pyridoxal 5-phosphate, often called P5P, plays a far more critical role in diabetes than most people realize. Even a slight deficiency can silently disrupt your blood sugar control, damage your nerves, and impact your heart health, all without early warning signs. This is not just a supporting nutrient. It is involved in more than 100 enzyme processes related to glucose metabolism, amino acid breakdown, and neurotransmitter production, which directly affect pain, mood, stress, and sleep. How does it help people with diabetes? Vitamin B6 improves insulin sensitivity by enhancing how well insulin receptors work, allowing your cells to absorb glucose more efficiently. Studies show that a deficiency in vitamin B6 can increase insulin resistance markers by up to 32%. Supplementing with the active form, P5P, for just 4 weeks has been shown to reduce post-meal glucose spikes by 21%, especially in people with type 2 diabetes. It also helps regulate gluconeogenesis, which is the liver's process of releasing sugar into the bloodstream overnight. If your morning blood sugar is consistently high, low B6 might be part of the reason. When taken with magnesium, it can help reduce early morning sugar surges by up to 18%. Protecting your nerves. One of the most dangerous long-term effects of diabetes is nerve damage, especially in the hands, feet, and legs. This is where vitamin B6 becomes essential. The active P5P form helps produce myelin, which is the protective layer around nerves. Without enough B6, neuropathy symptoms like burning, tingling, or numbness can worsen. Research shows that people with diabetes and neuropathy who took P5P experienced up to a 41% reduction in nerve pain after 3 months, along with improved reflexes and better nerve sensitivity. It also supports neurotransmitter balance, which can help reduce mood swings, anxiety, and poor sleep, all of which are common in people with fluctuating blood sugar levels. Supporting heart health. The heart often suffers silently in people with diabetes. Vitamin B6 lowers homocysteine, a harmful amino acid linked to heart attacks, artery stiffness, and poor circulation. Diabetics with low B6 levels face a 34% higher risk of heart disease due to increased oxidative stress and reduced vascular flexibility. Taking 20 to 50 milligrams of P5P daily may lower inflammation in the blood vessels and improve their function by up to 25%, especially in those with long-term diabetes. Protecting the kidneys. Your kidneys are also highly vulnerable to damage from high blood sugar. Vitamin B6 helps reduce inflammation in the kidney's filtering system and slows the leakage of protein into the urine, an early sign of kidney damage. In people with early-stage nephropathy, B6 supplements reduced microalbumin levels by 17%, helping maintain kidney function. It also protects kidney tissue from oxidative damage caused by excess blood sugar and toxins. Other benefits of vitamin B6: strengthens your immune system, supports red blood cell production, enhances digestive enzyme activity, reduces risk of fatty liver by improving fat metabolism. Deficiency can cause brain fog, tingling, frequent illness, or even mouth ulcers, signs many diabetics overlook. Top 5 natural sources of vitamin B6. Chicken breast contains 0.5 milligrams per 100 grams, providing about 38% of your daily need. Wild-caught salmon offers 0.9 milligrams per 100 grams, contributing around 69% of the daily value. Bananas contain approximately 0.4 milligrams per medium fruit, which is about 30% of the daily requirement. Spinach provides roughly 0.22 milligrams of vitamin B6 per 100 grams. Avocados contain around 0.4 milligrams per 100 grams. Both spinach and avocados are excellent low-carbohydrate sources that contribute to your daily intake. The recommended daily allowance for adults is between 1.3 and 1.7 milligrams. But many health experts believe that people with diabetes may need up to 2.5 milligrams per day, especially if they are dealing with neuropathy, kidney stress, or chronic inflammation. When your diet falls short, supplementation may be necessary, but choosing the right form is crucial. The most effective and safest option is the active form, Pyridoxal 5-phosphate, also known as P5P, not the less bioavailable pyridoxine. Here are 3 trusted P5P supplements considered safe for diabetics. Pure Encapsulations P5P, 50 milligrams. Thorne Research P5P, 33 milligrams. Now Foods P5P, 50 milligrams. These brands use the active form and avoid unnecessary fillers or harmful additives. Doses typically range from 20 to 50 milligrams per day, depending on your lab results and symptoms. However, it is important to avoid high doses, particularly anything above 100 milligrams per day of regular pyridoxine, as this can cause nerve toxicity, leading to numbness, balance issues, or even worsening neuropathy. Careful dosing is essential. Also, if you are taking medications like levodopa, hydralazine, or isoniazid, be aware that they can interfere with vitamin B6 absorption. Your healthcare provider may need to adjust the dosage or form to reduce interaction risks. Space supplements a few hours apart from your medications. Long-term alcohol use, kidney disease, and protein restricted. Diets also raise the risk of vitamin B6 deficiency, which makes regular monitoring even more important. Methylcobalamin, the active form of vitamin B12. Vitamin B12, especially in its active form methylcobalamin, is one of the most commonly overlooked nutrients among people with diabetes, and this silent deficiency can gradually harm your body without obvious warning signs. Vitamin B12 does not just protect nerves and support red blood cell production. It is vital for maintaining overall metabolic balance. When your B12 levels drop, your blood sugar can spike, nerve damage accelerates, and mental clarity fades. Even a mild deficiency can increase insulin resistance by 29%, slow down glucose absorption into cells, and raise post-meal sugar spikes by 22%, leading to an HbA1c increase of up to 1.2%, all without any early symptoms. What is even more alarming is that metformin, a common diabetes medication, can triple your risk of vitamin B12 deficiency by blocking its absorption in the gut. If you have been on metformin and have not checked your B12 levels in the past 6 months, your nerves, brain, and cardiovascular system could be at serious risk. And no, fatigue or forgetfulness is not always just a part of aging. It could be the early signs of demyelination, a condition where the protective coating of your nerves breaks down, leading to lasting damage if not treated in time. Research shows that restoring B12 levels can improve nerve conduction speed, reduce burning or tingling pain, alleviate neuropathy symptoms by up to 38% when caught early, heart health at risk. Low vitamin B12 also poses a serious threat to your heart. It causes levels of homocysteine, a toxic amino acid, to rise. In people with diabetes, elevated homocysteine is linked to a 34% higher risk of heart disease, as it contributes to inflammation, arterial stiffness, and plaque buildup. Vitamin B12 helps clear homocysteine from the blood and supports the production of healthy, red blood cells, enhancing oxygen delivery and reducing vascular inflammation by up to 20%. Critical for keeping arteries flexible and healthy. Kidney and brain support. Your kidneys, already under constant stress from high blood sugar, can suffer faster damage when vitamin B12 is low. This vitamin reduces oxidative stress and inflammation in the glomeruli, the kidney's filtration units. Studies show that restoring B12 levels may improve kidney filtration by 12%, reduce albumin leakage into urine, slow progression of diabetic kidney disease. This is crucial because once kidney damage becomes advanced, dialysis may be the only option left. Low B12 levels also affect your brain health. Memory issues, confusion, mood swings, and even depression can all be early signs of deficiency. Vitamin B12 is essential for producing serotonin, dopamine, and norepinephrine, the key neurotransmitters responsible for mental focus and emotional balance. In people with diabetes, this becomes even more concerning, because fluctuating glucose already strains the brain. When combined with low B12, cognitive decline can occur up to 40% faster compared to those without diabetes. Immune system and liver protection. Vitamin B12 also plays an important role in strengthening your immune system. It helps white blood cells function effectively, which is critical for people with diabetes, who tend to heal slowly and are more prone to infections. Additionally, B12 supports methylation, a key detoxification process in the liver that helps prevent fat buildup and inflammation, both common complications in type 2 diabetes. A deficiency in B12 can contribute to non-alcoholic fatty liver disease, a condition that now affects over 50% of people with diabetes in the United States. What makes this more concerning is that the symptoms of B12 deficiency often resemble the typical complications of diabetes. You may feel constantly tired, mentally foggy, physically weak, or experience tingling and numbness in your hands and feet. These are not minor symptoms. They are early warning signs that your nervous system is under serious strain. What is even more alarming is that a simple blood test can detect this deficiency early, but many people only get tested once significant damage has already occurred. Best natural sources of vitamin B12. Clams, approximately 84 micrograms per 100 grams. Beef liver, approximately 70 micrograms per 100 grams. Wild-caught salmon, approximately 4.9 micrograms per 100 grams. Grass-fed beef, approximately 2.6 micrograms per 100 grams. Fortified nutritional yeast, approximately 8 micrograms per 1 tablespoon. These foods contain vitamin B12 in its bioavailable form, making them easier to absorb. However, for many people with diabetes, absorption is impaired due to gut damage from inflammation or medications, so food sources alone might not be enough. If absorption is poor or your diet is limited, methylcobalamin supplements are often the best next step. Top methylcobalamin supplements for people with diabetes. Jarrow formulas. Methyl B12, 1,000 micrograms. Garden of Life. B12 spray, 500 micrograms. Solgar methylcobalamin, 1,000 micrograms. These supplements are designed for better absorption and can be taken daily or weekly, depending on your individual levels and medical guidance. While the general recommended intake is between 2.4 and 2.8 micrograms per day, people with diabetes, especially those taking metformin, may benefit from 500 to 1,000 micrograms daily, particularly if symptoms are present. Vitamin B12 is water-soluble, so excess amounts are usually flushed out through the urine. However, extremely high doses, above 5,000 micrograms, daily for long periods, may occasionally cause side effects such as acne, dizziness, or low calcium levels due to rapid red blood cell production. Those with chronic kidney disease should be especially cautious, as impaired kidney function can cause the body to retain excess B12, Always consult a healthcare provider before starting high-dose supplementation. Neglecting a vitamin B12 deficiency is like slowly shutting down vital systems in your body. First, nerve function begins to deteriorate. Then, mental clarity declines. Your heart works harder, and before long, you are facing serious complications that were completely preventable. Keeping your B12 levels optimal is about more than just preventing deficiency. It is about protecting your nervous system, brain, heart, kidneys, and metabolism from the long-term damage caused by diabetes. L-Methylfolate, the active form of folate, vitamin B9. Vitamin B9, commonly known as folate in its natural form and L-methylfolate in its active form, is one of the most underestimated nutrients in diabetes management. Yet, its impact stretches across everything from blood sugar regulation to nerve protection. Contrary to popular belief, folate is not just important during pregnancy or for preventing anemia. It plays a central role in DNA repair, cellular health, and most importantly, in controlling homocysteine, a toxic amino acid that accumulates quickly in people with diabetes. When homocysteine builds up, it silently causes blood vessel damage, nerve pain, kidney stress, and raises the risk of stroke by up to 80%. If you are diabetic and not getting enough active folate, you are increasing your risk of blood sugar instability, poor insulin response, and accelerated organ damage. What research shows? L-methylfolate supplementation improves insulin sensitivity by up to 17% in insulin-resistant individuals, reduces oxidative stress inside cells, improving glucose uptake in both muscle and fat tissue, lowers HbA1c by 0.5 to 0.7%, which is associated with a 21% reduction in diabetes-related complications. While a 0.5% drop in HbA1c might sound small, it can significantly lower your chances of developing neuropathy, kidney disease, and heart problems. Folate also helps regulate in fasting blood sugar levels. Studies show that when combined with a low glycemic diet, L-methylfolate can lower fasting glucose by up to 9% as by improving liver function, balancing cortisol levels, and enhancing carbohydrate metabolism. It also reduces post-meal blood sugar spikes by calming inflammation in the blood vessels, allowing them to remain more flexible and responsive to glucose surges. Without it, you may feel drained after meals, dizzy, or experience intense blood sugar crashes later in the day. Nerve damage from folate deficiency. This is where the consequences become even more serious. People with diabetes and low folate often report symptoms such as burning feet, tingling hands, restless legs, sharp, worsening nerve pain at night. Why does this happen? Because folate is vital for producing myelin, the insulating sheath around your nerves. It also supports the conversion of key neurotransmitters like serotonin, dopamine, and norepinephrine, which influence not just nerve function, but also mood, focus, and memory. 2023 meta-analysis found that combining vitamin B12 and folate supplementation can reduce diabetic peripheral neuropathy symptoms by up to 30%, especially in older adults. Kidney and heart support. The kidneys are another major organ affected by folate deficiency. L-methylfolate supports glomerular filtration, function, lowers protein leakage into the urine, and protects delicate capillaries from sugar-induced damage. A chronic folate deficiency may lead to microalbuminuria, an early and silent marker of kidney decline. Supplementing with folate has been shown to slow the decline in estimated glomerular filtration rate, eGFR, a key measure of kidney function, by reducing homocysteine and inflammation, the two major drivers of diabetic kidney disease. The cardiovascular system is also deeply impacted. Folate improves arterial elasticity, reduces stiffness, and has been linked to a 19% lower stroke risk in high-risk individuals with diabetes. Folate also enhances vascular nitric oxide, which helps keep blood vessels open, flexible, and responsive. But its benefits do not stop there. Folate plays a key role in improving blood flow to the retina, lowering the risk of diabetic retinopathy, a leading cause of vision loss. It also supports liver health by aiding in methylation and preventing fat accumulation, a major contributor to non-alcoholic fatty liver disease, which is increasingly common in people with type 2 diabetes. In the brain, folate helps sharpen cognitive function, and low levels have been linked to early signs of dementia, depression, and mood disorders. Folate even contributes to immune function, hormone balance, and blood pressure regulation, often working silently in the background. Unfortunately, signs of deficiency are often missed or misdiagnosed. These may include mouth sores or ulcers, swollen tongue, pale or dull skin, irritability, and mood swings, brain fog or trouble focusing, frequent infections. Some people with diabetes may also notice muscle weakness, vision changes, depressed mood. These symptoms are often blamed on other issues, but in reality, they may be early indicators of folate deficiency. In men, low folate can quietly affect sperm quality and testosterone regulation, while in women, it can disrupt hormone balance and menstrual health. Despite this, testing for folate is often overlooked until complications arise. Top natural folate-rich foods, safe for people with diabetes. Cooked lentils, 358 micrograms per 1 cup, provides nearly 90% of your daily requirement, plus rich in blood sugar-friendly fiber. Steamed asparagus, 268 micrograms per 1 cup, also rich in antioxidants that benefit the nervous system and blood vessels. Cooked spinach, 263 micrograms per 1 cup, offers natural iron and chlorophyll supporting red blood cell function. Black-eyed peas, 210 micrograms per 1 cup, low glycemic and supportive of both heart and kidney function. 5 avocados, 80 micrograms per half fruit, provide healthy fats that help regulate blood sugar, reduce cravings, and support hormonal balance. Many diabetics, especially older adults or those with digestive issues, struggle to convert synthetic folic acid into its usable form. This is often due to a common MTHFR gene mutation found in up to 40% of people, which reduces the body's ability to activate folate. For these individuals, the best solution is L-Methylfolate, the active and most bioavailable form of folate. Top L-Methylfolate supplements for diabetics. MethylPro L-Methylfolate, 1 mg, high purity and maximum absorption. Thorn 5-MTHF, 1 mg, clinically respected and effective for neuropathy, pure encapsulations folate, 800 micrograms, gentle on the stomach and ideal for daily use. The general recommended daily amount for adults is 400 to 600 micrograms. However, diabetics with folate deficiency or elevated homocysteine may require 800 to 1,000 micrograms daily for 2 to 3 months under medical supervision. Important note: taking more than 1,000 micrograms of folate daily for extended periods without checking your vitamin B12 levels can be harmful. High folate intake can mask a vitamin B12 deficiency, potentially leading to irreversible nerve damage. Rare side effects of excess folate may include nausea, insomnia, bloating, skin irritation. Folate supplements may also interact with methotrexate, anticonvulsants, and sulfasalazine, so speak to your doctor if you're taking these medications. Every person with diabetes should ask, could I be missing this silent protective vitamin? Without enough folate, blood vessels harden, nerves begin to misfire, kidneys deteriorate silently, blood sugar control becomes unstable. You may believe you're managing your diabetes well, but if your folate levels are low, you're building on a weak foundation. Folate isn't just another vitamin. It's a cornerstone of stability across your entire system. Thanks for staying with me through this important guide. If you're committed to protecting your body and managing diabetes wisely, hit the like button, leave your questions in the comments, and subscribe for more powerful insights. Your health is your greatest asset. Don't let a lack of knowledge put it at risk. Let's continue learning, growing, and beating diabetes together. Stay strong, stay informed, and I'll see you in the next video.